Good morning, everybody, and thank you for joining us today for this week's weekly press briefing with County Executive Marc Elrich. Today, we have joining us as normal, Dr. Earl Stoddard, who will be here, along with Sean O'Donnell from the Department of Health and Human Services. We also have a special guest joining us today, Patrick Campbell, who's also here from the Department of Health and Human Services, specifically to talk about emergency response to the explosion and fire that took place last week. Reporters, please remember, if you still need permission to record, put that into the chat. If you have questions for any of our panelists here, please also list those in the chat, and we will get to everyone in turn. We do have a hard stop today at 12 noon. The county executive will talk about why. So without further ado, I will hand it over to County Executive Marc Elrich.
Thank you very much. I want to thank everybody for joining us today for our weekly media briefing. I'm speaking to you today from the offices of the Metropolitan Washington Council of Governments, or as it's known as COG. And at noon, there's going to be a COG board meeting about local climate and energy action planning efforts. Our interim Department of Environmental Protection Director and the person who heads up our climate plan in general, Adriana Hochberg, is going to be presenting our climate action plan and discussing how we are going to be working to fight climate change in Montgomery County. It's one of the most aggressive plans in the country. And I wanted to be here to help emphasize to my colleagues in the region how important it is that fighting climate change is for all of us. We need a regional approach. We actually need a national approach in order to make a difference in fighting climate change. The more that everybody does, the easier it's going to be for any one of us to accomplish some of this. As we've seen, gas prices have hit historic record highs. This is an important time to talk about our local environmental policies and plans and how we can continue to decrease our dependence on oil and other non-renewable resources. I'm proud of the roadmap we've created with our climate action plan to reduce 100% of our carbon emissions by 2035 and the work we've done to electrify our fleet of vehicles, expanding solar production in the county, and putting forward our building energy performance standards legislation, which the council still has not voted on because it's tied up in a committee 11 months after we introduced it. We will continue to fight for clean energy because it helps us combat climate change. But as we adjust the current gas prices continuing to rise during the war in Europe, I encourage all residents to consider utilizing public transportation, carpooling, or teleworking when these are feasible options for you to help you save money, but also to help the environment. And if you're in the market for a new car, think electric. There's a ton of new electric vehicles coming on the market. Some of these vehicles have crossed the $30,000 price barrier. So the prices are coming down, the mileage is going up. I've been a convert. I've been driving electric vehicles since 2013. They've only gotten better, and I can safely say that I am personally beyond range anxiety. No longer do I wonder whether 89 miles is going to get me through my day. When you've crossed the 200-mile mark, it's pretty easy to see how you can make this work. If we're to become energy independent and sustainable nation, we're going to have to start implementing the right environmental policies. And we need to be doing this now. Policies from the local to the state to the federal level. There's legislation, critical legislation in Annapolis I've testified on already during this session, and there are a lot of legislators who are ready to move this state forward, and we just need everybody's cooperation so we can continue to make progress. As far as our COVID rates, this week our case rates have been hovering in the mid-40s per 100,000 residents, which is about 1/3 lower than the level it was last month, but we're still in moderate transmission. Bear with me 1 minute. I don't know what happened to my computer here. Yep. Sorry about that. Just 2 months ago, on January 8th, we were at 2,138 residents per 100,000. 47 times the level that we're at right now. Our test positivity rate continues to drop as well. We're now at 1.5%, which is a 2 percentage point drop since last month, and over 25 percentage points lower than it was during the height of the Omicron surge. And our hospitals are currently have 4.2% of their inpatient beds occupied by COVID-19 patients. This is a number that got as high as 30% in early January. So much as we thought, we're beginning to come out of the shadow of Omicron, and hopefully nothing else will drop a shadow across us too soon. We'll be able to enjoy a little bit of peace and normalcy for a while. Due to our current low COVID rates, the Board of Education voted yesterday to end mandates for mask wearing in MCPS public schools. Now masking is optional for students, teachers, and staff. As I've mentioned before, from the correspondence I received on this issue, it's about 50-50 split from what I've seen between those who want the masks to remain in schools and those who wanted the mandate to be removed. I have to say it was disheartening to read that a portion of yesterday's board meeting was disrupted by people who opposed the mask mandate. And I'm proud of how the board handled these disruptions. I also thought that the comments by the board chair that bullying was not to be tolerated by anyone, whether they want to wear a mask or don't want to wear a mask, is completely inappropriate. They're boards, they're on or off. It's just me. Be kind and respect my mask choice. That's the slogan. And it's a good lesson beyond the classroom and throughout the country at this time. You can see this nice little graph. As you heard me say many times, masking works. All the evidence shows that masking works. It helps reduce the spread of germs. I hope that any student, parent, teacher, or staff member of MCPS, or frankly, any place else in the county, feels empowered to make whatever decision they feel comfortable with at this point for their own or their child's health and safety. I want to talk a little bit about the tragic explosion at Friendly Gardens Apartments last week. The good news that nobody so far has lost their life. I want to thank the Montgomery County Fire and Rescue Services, Emergency Management, Health and Human Services, the Housing Department, Montgomery Housing Partnership, and the Red Cross for all their work at Friendly Gardens in the wake of that explosion last Thursday. I've been out there to the apartments multiple times now, and we are so fortunate that there weren't any fatalities. As we stated during our briefing on Monday, this incident was caused by a maintenance worker who mistakenly cut a gas pipe. These were exposed pipes. They didn't need a permit to work on them. They didn't need an approval or an inspection from WSSC or anybody to do the work. This was supposed to be the maintenance worker unclogging a drain. Unfortunately, he cut a gas line instead of a drain line, put a cap on it that didn't hold, and everything else that unfolded was a result of that. It's not an incident that we could have prevented. There's no way we could prevent somebody from cutting a gas line, but there are some things we think that can be done. It was clear from the pictures of these pipes, they're not labeled. They don't have what's required now, which is, a plastic sticker every 5 feet delineating this as a gas line. That's the policy in newer buildings, but it is not the policy in buildings that are this old. I think the proper labeling of exposed pipes in all commercial apartment buildings, no matter what the age is something we need to look at and regulate. And we're looking to see whether the county has authority to regulate in this domain, and whether we're going to have to ask WSSC, which controls both the water and gas side of this, whether they can impose that regulation. But one way or the other, we are going to get regulation on this so that nobody else walks into a basement and looks at a bunch of pipes and has to guess which is gas and which is water. We cannot afford to have this happen again. We're fortunate that, like I said, that no one died here. We may not be so fortunate if this happens again. And so we're going to do everything we can to make sure we can prevent that. I also want to thank our community for stepping up and helping these impacted residents. And immediately following this explosion, our nonprofit partner, Montgomery Housing Partnership, set up a fund to assist these residents. They've raised more than $480,000 so far. This generosity is greatly appreciated and demonstrates how we look after our neighbors when tragedy strikes. We're going to continue to work with these residents, property management, and this community as we try to bring normalcy back to their lives following this horrific disaster. I encourage all residents who want to help to donate to these residents through mhpartners.org. I saw the devastation firsthand, and I just, ask yourself, what would it be like if you came home from work or you were a kid and you came home for school and what you were looking at was a pile of rubble and everything you ever had, everything you valued, whether it's pictures, clothes, food, a computer, that it was all gone, because that's what people faced when they came back to those apartments, just a pile of rubble and still smoldering, and everything that they had in those units that burned, you would not have been able to retrieve anything from there. These families have to start over again, and getting your support is going to make a big difference. I'm proud of the work of the government and our partners to support the community and county. And Patrick Campbell, who's the senior planning manager at HHS, is leading up to these efforts, and he's going to be on this call today if you have any questions for him. We do know that the one building is a total loss. Two buildings had some structural damage, and they're assessing how rapidly they can fix that. We do not anticipate at this point that this is going to be long-term, but it's not going to go away in a day either. So they're working to get those buildings back in order. It's the one unit with 15 or 14 units, and it's the one building with 15 or 14 units in it that is not coming back. And we're aware of that. HSC is working with us. They've identified apartments in Paddington Square, which is right around the corner from here, for a number of the residents. And I think they were actually interviewing people either yesterday or today. And we're going to continue to work with our nonprofit partners to identify the units so that all the people who are going to be permanently displaced can get back into permanent housing as quickly as possible. This month is Montgomery County's month of recognizing and commemorating 2 years of fighting COVID. And we began last week with a Memorial Week, a remembrance of the lives lost to COVID, culminating in a really beautiful candlelight vigil last Thursday. We were joined by residents, faith leaders, community leaders, and I just want to thank everybody who put this together and everybody who showed up on that cold night to honor those who we lost. This week is Public Health and Healthcare Week, recognizing all the individuals who've been working tirelessly over the past 24 months to keep us healthy, safe, and alive. From frontline emergency workers in our hospital to scientists and technicians in the thousands of labs to our own government's health and first responder teams, tens of thousands of our residents, workers, friends, and family have lent their skills and talents to response and recovery efforts. We are honoring those indispensable workers during a very sobering time. This week, our planet surpassed 6 million deaths due to this pandemic, with our nation nearing 1 million fatalities, by far the most in the world. It is a shame that the leading industrial country in the world, with the most tools available to it in the world, is leading the world in deaths. It should not have been like this, and it should not be like this. This is an important time to express our appreciation to all those who contribute so much to ensure the number of deaths from COVID in this county weren't higher. And I just really want to convey my real sincere appreciation of everything they did. Their perseverance and dedication over the past 2 years has been inspiring. After coming out of one of the worst surges since the beginning of the pandemic, our healthcare workers are overworked and overstressed. Now more than ever, they need to be lifted up and encouraged to continue in these efforts. I hope all of our residents will join us in thanking all of these important workers who work every hour, every day of the week and every week of the year to keep us all safe, healthy, and alive. And if you know a healthcare worker, please go out of your way to thank them for their dedication and their perseverance. I had the opportunity to be in healthcare settings, even in hospitals, during the peak of COVID. I talked to the people who worked there. Despite the fact they were obviously tired, exhausted, frustrated. I think back in the early days when there were all those things, plus lacking the kind of protective equipment they needed because nobody had stockpiled it. You really appreciate the sacrifice and the fact that, much like you think about firefighters rushing into a burning building to save lives, I think we need to think of our healthcare workers in a similar way. They rushed into the fire of COVID and they stood there and did their jobs to keep people safe, despite the fact that they knew they were putting themselves at risk. And in this moment in time, there's honestly no reason for anybody else in this country or this county to die of COVID. We have the vaccines. Nobody has to get severe COVID. Nobody has to die from COVID anymore. We have it completely in our hands at this point to end the deaths from COVID. And it would be a good thing if people would recognize their power and their ability to make this happen and then go about and make this happen. This is something, and it's been true from the beginning of the pandemic. What we do as individuals and as people collectively determines how fast the virus spread and how many people got sick. What people do now, what choices they make, determines whether more people are going to die or whether we can put an end to this. So hopefully people will do the right thing. And at this point, I'm going to turn this over to Dr. Stoddard and Sean O'Donnell for their updates. Thank you.
Thank you very much, Mr. County Executive. Just ask Barry, perhaps if you could allow me to share my screen.
Got it, Sean.
Thank you. So for our colleagues in the media, we want to share that there has not been too much dramatic change over the last week from our last briefing. As the county executive mentioned, we are looking at the new metrics. We are working on our county dashboard to reflect these. One thing that we'll note is that the CDC's tracking of some of these metrics is a little different than when we track in our local jurisdiction. On the one hand, we are able to report the data approximately a day or two earlier than they do because of how they aggregate it. But we're also working with our county staff partners to determine exactly how the CDC is calculating their hospital data. It does appear that they may use a slightly different definition of the hospital service areas for Montgomery County. We're looking at it strictly within our county. Their definition of how they do this may be a little different. So there is a slight disparity in the hospitalization data between what we calculate in the county, but we're working to iron that out so we can be consistent. For example, our most recent hospital data as far as percentage of hospital beds with COVID patients just in our county is around 2.5%, which is a little bit better than where the CDC is reporting it. So again, we're working on making sure that we can share that information correctly and then link that into our dashboard so it's available on a daily basis to the community and all of our partners. The hospitalization levels have come down very significantly. Again, as we've mentioned, with only 2 COVID patients in our traditional hospital ICUs, and only 17 patients over at the alternate care site. Apologies. We are still tracking the deaths related to COVID, and as you can see, the gray bars are the Maryland statewide deaths, and the smaller blue bars are the Montgomery County deaths. You can see in February, there was still significant repercussions from the Omicron spike. And now that we're in March, those have receded quite dramatically. We are still in the early part of March, but we are seeing that these numbers start to come down. Again, it bears repeating as we're looking at much lower levels of community transmission or the CDC metric of community levels. We want to, again, share the data of how protective the booster shots are against death, how protective being vaccinated is against serious illness that results in hospitalization. So we strongly encourage people to get their boosters. The numbers within Montgomery County have not changed too dramatically since last week. A lot of the vaccination efforts have slowed, and to a bit of a trickle here. We're now at about 70% of our 5 to 11-year-olds with a single dose, and around 60% that have received their primary doses, both doses of Pfizer. Again, as we continue to track these, we are still seeing more disparity in the booster doses than we see in the first dose vaccinations by race and ethnicity. These numbers are, inching up about 1% or so each week in general across the board, but there's certainly all of these groups at this point are largely eligible. It's been more than 5 months since we did the 12 to 17 vaccinations, and a large part of that population received it very, very early. So again, across the board, there's a lot of availability for individuals to get boosters. And we strongly recommend it to protect against, any possible variant that could be out there. We certainly hope there won't be any more, but it's important to be protected before that happens. And then just finally, we continue to see masks and rapid test kits picked up at our library locations. They're, of course, available at this point at all hours that our libraries are open. We had about 26,000 of them distributed last week. So we continue to do that, and we continue to work with other partners to make sure that these are available to all of our populations within our county. At this point, I'd like to turn it over to my colleague, Mr. Campbell, for an update on the shelter recovery process.
Yep, thank you, Sean. So I did want to give a brief update on where the Department of Health and Human Services is presently at in supporting the residents from the Friendly Garden Apartments explosion. In addition, I just want to kind of paint a pathway and how we're going to be continuously assisting these residents down the road. The Department of Health and Human Services was present on site of the day of the incident. We actually established a reception center at 11:50 a.m. that day and began the steps of helping them recovery. Initially, the first day was dealing with assessing emergency and immediate needs. Over the weekend, the team is continuously outreach with families looking for emergent needs, making sure that we're addressing medications, school needs, things like that. But as of yesterday, the county, in partnership with various agencies, management and other departments and nonprofits, has stood up a disaster assistance center. Yesterday was the first day. Tonight we'll be continuing that outreach to the families. What we've identified with this population is the necessary need to have a warm touch outreach site for them. And so we decided to establish this in-person site. Yesterday, we were successful in reaching all but one of the families in person. They showed up at the site. They were able to provide financial assistance, housing assistance. We were able to connect them with crisis resources, Rex Department. We also brought in a couple of federal agencies, such as Social Security Administration. It was an attempt to make sure that we're presenting all the resources these families may need, because it's going to be things, vital records needing to be replaced, but also making sure we're engaging in that long-term housing question. We are very fortunate a lot of our partners did show up in strength, and a lot of the residents were able to show up as well. As of right now, from that Montgomery Housing Partnership Fund, over $70,000 of that money has actually been brought into the hands of the clients directly affected. So not only are we funding it, but we're making sure the clients are getting that assistance quickly. The county has also worked with property management to deal with reimbursements of their security deposits and rent checks and things like that. That way, these folks have tools in their hand very quickly to begin recovery. In terms of assisting these families with both short-term and long-term recovery, the county is working with the families to identify what are their housing needs. Sometimes it could be quick placements in apartments. Sometimes it may temporarily be Airbnb and other options like that. So we're working with each family on an individual basis to continue that. All families have been in touch with my agency. They typically receive one call a day, and they also have the ability to outreach to us via text and/or phone. Tonight will be another round of disaster assistance center where further assistance will be provided for the residents. The White Oak shelter is still open at this moment. We also have a call center essentially set up for these residents as well. And that's the group that actually outreaches them daily and the residents can call to So we've been very fortunate that we've had, a lot of push and a lot of support from within the county government, but also from our federal and state partners to ensure that these residents' emergent needs are met. And we're very fortunate to say that we're already working on those long-term housing plans, and we've been very proactive on this. So next steps for us tonight really is going to be the outreach event, but over the coming days, we'll be assisting families with emergent housing needs and then making sure we're addressing those next. No further comment at this time.
Thank you. Thank you for your comments there, Patrick. We're going to move on to Dr. Stoddard, if he has any comments to make today.
No opening comments. Let's go ahead and go to questions.
All right. So we're ready for questions. First question I have before we go further, Patrick, I think we're getting some feedback from your mic. A lot of feedback coming through when your mic is on, so thank you. First question we have is from Kate from WTOP. Kate, can you go ahead and pose your questions?
Absolutely. The first question is, again, we're at the booster rate of apparently 53%, and it looks like the biggest gap is among those 5 to 17. Is that right? Do we know why that stays stubbornly low?
So first I'd say, of the folks who are eligible to get a booster, it's closer to 56%. The 12 and up population is what I would look at there. I know it's a relatively minor differentiation there, but there's likely a number of different factors, but as we saw from the chart, our senior populations are the highest boosted. They're also the highest initial doses of vaccination. They're the ones at the greatest risk, and they've responded the best to our messaging. Most significantly for the first 2 doses, a bit of a fall off for the boosters, even in that group. And that's the group we're most concerned about boosters. Of course, our younger populations, they go to a congregate setting in schools every day. And so we would like them to be up to date as well to help limit future transmissions between each other and within their families, and ultimately to those people who are at the greatest risk, our older populations and those with underlying conditions. So again, I will say that when you want to vaccinate a younger population, you need to coordinate more elements. You need to coordinate not only their schedule, but their parents' schedule to get them vaccinated. And that is certainly an additional hurdle than an adult deciding I'm going to stop off and get my booster today. We have made these available we've made boosters available at our school clinics since the beginning of January. So we're not just doing the 5 to 11-year-olds at those clinics. We're doing anyone who needs a booster as well. So we've certainly been out there, and we're certainly encouraging it, but we'd like to see more people take advantage of it.
Right. Are you concerned in light of the lifting of the mask mandate in schools that, again, it appears to me, if I'm reading the charts correctly, that those who are least boosted are children?
Yes, that's correct. The children have the lowest boost. Those 12 and above have the lowest booster rate. And I would say most of those are eligible because we saw a large turnout when they first became eligible to come out. Certainly some of them may not be eligible yet because they only completed their primary doses within the last 5 months. But yes, that 12 to 17 population are the ones who have the lowest boosted levels.
Kate, what I would say is, given what I would expect to be relatively low transmission rates during the spring and summer months, I think the problem with the booster rate in the school system particularly will be most apparent next fall when the students return after the summer break, because that obviously is the period of time when I would expect that, because of the natural seasonality to respiratory illnesses, we'll see an increase in spread in the community. If the booster rate remains similarly low, or people allow longer attrition between their primary vaccinations, and it's one of those problems where it's not a static point in time. It'll get worse. People will have less and less immunity if they don't get boosted. And so I would expect that we're going to have a big push to get people boosted before the school years. Otherwise, we took masks off yesterday. I think we could see a lot more problems in schools in the fall if people maintain a similarly low vaccination rate during a period when the virus is spreading more regularly.
Yeah,
Gotcha.
that's a really, really good point. The one other thing I would share as an emphasis that our CDC partners and our state partners have made over the last week or so is there's been some shift in their guidance. And that is that there's likely the other source of immunity that's occurring in our populations is the Omicron surge that affected so many people. So there is likely multiple ways that immunity is being cast. Excuse me.
Got it. And then if I can follow up on Mr. Elrich, you talked about, go electric if you want to beat the high gas prices. A lot of people, both in DC, for example, but also out in areas that are less dense, say the problem is access to
Yep.
chargers. If you are not in a single family home, that's the issue. And what can or is the county doing there? I
Yep.
know the governor had talked about making that more accessible. And a follow-up, what about bus fares? Are we charging for a ride on bus right now? Is that still free? And do you expect to see a jump in use of ride on?
So I'll start with the last thing. Right on, ridership recovery it's recovering, but it's not back to where it was. And our fares right now, they're still free. But in our system, unlike a lot of other mass transit system, bus riders tend to be non-choice riders. They skew heavily to people who don't have alternative ways of getting to work. Our fares were never exorbitant, but it's clear that we'll see if it makes much difference. Even when they're free, we're not seeing a big surge. So that one we'll play by ear right now. As far as the other issue, part of our plan is to expand the implementation of chargers. We've talked with Pepco about what we can do. One of the things we're trying to figure out is, in what cases can we add a charging station to where there's a utility pole? So that would be the easiest thing, would be to add charging stations on the streets. We've added charging stations. We're going to continue to add charging stations to our public facilities. There need to be a lot more of them. So we're going to do on our end, we're going to bring more out. I know that the president and the governor have both talked about increasing investment, and that should help us because, after all, we're the ones that would benefit and be the ones who implement any increase in investment. So hopefully we'll continue to see additional charging stations. I know what that feels like, because in the early days, imagine being around in 2013 with a car with 87 miles range and looking at your car go into turtle mode, and then wonder whether the turtle's going to be able to crawl to the closest charging station. It has come a long way from where we were in 2013. We're still not where we need to be, but we're going to continue to build out the infrastructure so we can get there. But I feel totally comfortable now driving around the county.
Yeah, and also the
Thank
federal
you.
infrastructure bill did include $5 billion for state administered grants to build out EV charging technology across. So we're expecting to see that coming through over the next year to start really helping to build out some of those additional programs.
Thank you very much.
Next question is from Steve from Bethesda Beat.
Afternoon, everyone. This one's for the county executive. I just wanted to ask kind of a different topic here about the Silver Spring kind of area. A lot of residents and businesses sent a petition to you and a lot of other officials about the crime there, kind of late night activity with businesses, kind of attributing a lot of it to that. I just kind of wanted your reaction. Over 600 people signed on to this petition. I guess just what's your initial reaction, I guess, to start off with that?
Well, I mean, the petition followed the increase in criminal activity. It also followed the increase in our suppression of that activity. So we began acting to, using cameras to identify cars that were either stolen or didn't have legitimate plates. We've been doing we've been visiting late night businesses and bringing in inspectors, and we issued fines in a number of cases, and the number of fines now that we're issuing has greatly gone down. And we've gotten positive feedback from some of the people who were very critical of us. Brian Folger was one of them, who actually felt like the things we're doing are having an effect. Our approach is not going to be to have an effect and then stop doing stuff. Things that have worked, we're going to continue to do those things. People need to feel safe. You should be able to go to an ATM machine or walk down the street in the middle of the afternoon. Our officers are far more present than they were at the beginning of that. And I just want to say when they weren't present, it wasn't because of any decision that we had made. There was a decision apparently independent of what the county government had suggested. So we're glad to see everybody back where they belong. And I think we're having an effect. And we do hear the residents, and we are looking at what the possibilities for legislation on some of these things might be.
Does that include limiting, they obviously have talked about the hours of operation for some of these businesses. That's something they think needs to be looked at, frankly, or other kind of avenues that you just described?
I personally do. I know this is going to be a big issue for some people, but I do not think it is worthwhile having places open after the drinking hours. It becomes very hard for the county, for example, to enforce whether somebody's bringing alcohol into a facility where they're not supposed to have alcohol. We don't have a BYOB policy where you can come into a place at 3:30 in the morning and start pouring yourself and your friend shots. So it would be extraordinarily difficult for the county to enforce that. So I do feel there are reasons why we should limit hours, and you may well see legislation on that.
This next one might be for Patrick. I know the county executive had mentioned that some of the people that are displaced are likely going to head over to Paddington Square. Do you have any kind of idea on the breakdown on where people might be heading in the coming weeks, including how many might be headed across the street, or is that still TBD?
It's going to be very various. We do know the majority of the residents would like to stay within the Beltway. It is where their community is. Where exactly they're going to lay down, it's going to depend. Each population is so varied, and the biggest challenge is going to be just finding the rental rates that they need and that we can subsidize appropriately. So I would assume right now, based on current availability, a couple families move over to Paddington, but many of the properties down in that area have very low available properties, and sometimes it's just matching the appropriate size. So not in a way I can answer directly because it's still very early in the process.
The other thing, Steve, I would, you've been on site, so you know the layout. So there are two adjacent buildings, 2401 and 2411, which are currently displaced because of some damage that was observed. I do know that there is going to be a third-party structural engineer on site tomorrow from having spoken with the property management company, Residential One. And once that structural engineer gets to go through, has to go through essentially unit by unit, we'll have a much better sense of how long the displacement might be for those two adjacent buildings. And obviously, given there's 14 or so units in each of those two adjacent buildings, if we're having to move 14 units versus 42 units, that's obviously a much bigger challenge. So we're trying to figure out exactly. And we've got a affordable housing challenge, as the county executive has long talked about in the county. So obviously making sure that, trying to identify who needs a new unit and finding new units placement is going to be a big challenge, particularly as Patrick said, from the affordability standpoint for these residents. And so this was a very affordable location that they were living in. So finding a comparable, large enough multi-bedroom for larger family units, particularly, it's going to be challenging, and always is in these kinds of events. But I think the first step is really figuring out how long the displacement will be for those other two buildings. And then we'll have a much greater sense of how long it's going to take to make the placements.
This last follow-up is a pretty simple one. It sounds like, have the property manager and or the owner been on site since this has happened? And what's the timeline been there?
So yes, the property management has been on site. And in fact, they were even at the Disaster Assistance Center yesterday, meeting and checking in on families as well.
But the owner, do we know about the owner? Because I know that there's a difference there, I think.
That I just can't confirm for sure. I'd have to look into that, but property management has been very engaged and has actually reimbursed a lot of the families, both their rent that they already paid and their security deposits as of yesterday. So property management's been very engaged. I just can't confirm for sure on ownership.
I do know the board, they have a board as well. And I know several, I actually walked one of the members of the board around to the site the day of the explosion. So I know that several of the board members have been on site to, view the damage and work with the county on addressing the resident needs.
That's the property management company you're saying, or?
Yeah, I think they have a board for the entire property. I don't know exactly what their management structure fully is. I don't know if they are. I know this is a Quaker affiliated, I believe, property. And so I don't know whether they have a board structure, or I don't think they have a single owner. That I don't think it works that way.
Thank you, everyone.
All right, at this point, I don't see any more questions. So I'll ask one more time. Are there any more questions from the media? Going once, going twice, 3 times. Okay, thank you very much, everyone, for joining us again today. Look for us again next week with updates on things going on in the county. Also, as the county executive said earlier in the briefing, please take time, if you know a healthcare worker, to make sure that you thank them for their fantastic work over the last 2 years. And if you can, post on social media pictures or tributes to folks that you may know. So thank you very much and have a great rest of the day.
Thank you.